The CV19 Checkup Tool by BellAge is a free, easy-to-use online assessment tool you can use to evaluate your risk of getting COVID-19. It only takes a few minutes using your computer or mobile device. You can also use the tool to assess the risk of family members or friends. The CV19 Checkup Survey asks a series of questions about your social interactions and what measures you currently take to avoid the disease. Your risk is evaluated based on what researchers currently know about the spread of COVID-19. Your participation may also help scientists understand more about the spread of COVID-19 within communities. The CV19 Checkup Tool is completely anonymous. No personally identifiable information is asked for or required. Your results, including personalized recommendations from the U.S. Centers for Disease Control and Prevention and the World Health Organization, are available as soon as you finish the questionnaire. Open a browser and go to stlewis.cv19checkup.org. Click Let's Get Started. The first screen asks if you are completing the survey for yourself or someone else. Click the correct answer and a Next button appears. Click the Next button to go to the next page. This screen asks you to share your assessment of personal risk relating to getting COVID-19. Each question you answer leads to a follow-up question. What do you think your chances of getting COVID-19 are? Given what you know about your personal health, how certain are you would need or not need hospitalization? Do you think you would know if you were spreading COVID-19? And if you were to get COVID-19, how prepared are you? Do you have a place to go, a caretaker, and a stock of medicine and supplies for while quarantined? Click Next. Your zip code along with your age and gender are the only demographics collected by the CV19 tool. This is information that can be correlated to infection rates, hospitalizations, and outbreak monitoring in your area. It can help us understand how different age groups perceive risk, but doesn't tell us any personally identifiable information. When you are finished with the questions on this page, click Next. The next page collects information about your living situation. Do you live in a separate home or in a more densely occupied facility? And in your home, are there residents that live with a serious health problem that could affect COVID-19 outcomes? Pre-existing chronic health problems and your access to healthcare affect how sick you may become if you get COVID-19. Tell us how you are feeling and how others in your household are feeling about chronic health problems you have and what kind of health insurance coverage you have. Your activities in public spaces are determinants of your health risk. Click the circle for each of the activities you engage in. The number of people outside of your household that you spend time with and the amount of time you spend with people outside of your household impact your risk of getting COVID-19. List the number of people that you spend 15 minutes or more with at a distance of less than 6 feet. Wearing a mask, washing your hands, sneezing or coughing into a tissue or the inside of your elbow. These are safe behaviors known to reduce the spread of COVID-19. Choose how frequently you follow each of these safe behaviors. Life is challenging during this time. We all react to stress, isolation, and uncertainty in a different way. Choose how the pandemic is affecting you emotionally, if at all. The pandemic may have affected your ability to deal with certain life issues. This assessment tool will give you personalized recommendations and resources that may help you cope with your personal assessment based on the needs you select here. Your answer to this question is not required, but it may help us understand the impact COVID-19 is having on different populations. Your answer will not affect the recommendations. Congratulations! Your personalized report is based on the answers you provided. Your severity risk is calculated based on your activities, interactions with others, and the preventative measures that you take, as well as your age and health conditions. Your hospitalization and survival risks are calculated based on the historical data of others in your age, sex, and health groups. Your risk of getting and spreading COVID-19 is calculated based on your behaviors, activities, and contacts with others. Now that you know what your risks are, use the listed recommendations and resources to find ways to reduce your risk, better prepare for dealing with COVID-19 illness, and address mental stresses that you may be dealing with. thank you for taking the Bell Age COVID-19 checkup. Do your part to stay healthy and help contain this deadly disease. And join OASIS members in lifelong learning and healthy aging by signing up for an online class at oasiseverywhere.org.